Don't get liposuction on your thighs. Today, I want to talk about thigh liposuction. Many of you are probably struggling with lower body obesity, right? You might have tried various methods to lose thigh fat, like stretching and massaging, hoping to slim down your thighs, but have you ended up back again at thigh liposuction? So, are you wondering what to do and what things you should consider? Today I'll tell you 3 reasons why you shouldn't have thigh liposuction. So what are your other options? I'll also explain how thigh liposuction is done, so please stay tuned and watch this video until the end. Hello, I'm Dr. Ann, the president of Fat College. What do we usually mean when we talk about thigh obesity? It could be that there's a lot of fat overall on the thighs, or maybe it's just on one side, or even just on the outer part. Sometimes people are also worried about extra fat around their knees. There are all kinds of exercises you can do to target thigh fat, whether it's for the inner thighs or the outer thighs. The back of the thighs. Here are so many exercises out there that claim to target fat loss in specific areas. But is it really that easy? If you work out that area more, will it actually help you lose fat there? To a certain extent, it seems to make sense. But is the effect statistically significant? It's a question. Yeah? When you exercise, your overall metabolism increases, leading to weight loss effects, right? If you do a lot of thigh exercises, your thigh fat getting loose more faster? I think the fat on my face and chest comes off much faster. Thigh fat is the last to go. Why is that? The way you lose fat through exercise is closely related to blood circulation in that area. However, there's a lot of cellulite in the thighs, so the blood circulation there isn't as good as in the face or chest. Because of that, you might find that even with dieting and exercising, it takes a lot longer to see results, and it can be really frustrating. You work hard doing thigh exercises and stretching, but the results just aren't satisfying. So you think you should have thigh liposuction, and you've been doing a lot of research on thigh liposuction. However, thigh liposuction is not an easy surgery at all. There are a lot of cases where the results aren't great, because it takes really advanced skills and has to be done very carefully. Now let me give you 3 reasons why you shouldn't do thigh liposuction. Lumpy results are common. The first reason you shouldn't have thigh liposuction is that it's very easy to get lumpy results. Liposuction is kind of like getting a guy's sports haircut. You've got to do it smoothly to avoid any spots that look like a rat chewed on it, so it turns out nice. But when that doesn't happen, it can lead to lumpy results. If doctors haven't enough experience, the chances of this happening are really high. It's most common to make the inner thighs too deep or to create bumps in the front. The thigh is an oval shape. It's not like a flat table. Because of the curves, if you have thighs that curve forward a lot, you really need to be more careful. The chances of getting lumpy results are really high. So you need to choose a really good clinic for the surgery. If not, you might end up needing a revision. And those can be way tougher, like 2 or 5 times harder. That's why it's super important to go to someone who really knows what they're doing. The bilateral scars are really noticeable. The curve of the thigh is smaller than that of the abdomen. It's tough because the person doing the surgery isn't working on a flat surface. So, that means you need several incision sites. You basically need 2 in the front and 2 in the back. If you have to do surgery on the knees, you'll need to make another incision around the knee area. If the skill level isn't high, you might end up needing even more incisions. You might need 2 more on the sides and another 2 in the front, excluding the knees. That can total up to 10 incisions. Bilateral scars are really noticeable. If you do it on the inside of the underwear, it might be a bit less visible, but usually the incision is made along the groin line. So with the panty sizes that women wear, these areas are just going to be exposed. Sometimes there are doctors who will make the incision a bit more toward the center. In these cases, the scars are less noticeable, but even so, they still won't be hidden, so you'll need to wear short-sized underwear to cover the scars. There are often asymmetrical results. Each thigh has one, right? That's the issue. Since you're operating on each side separately, getting them to match perfectly isn't an easy task. A while back, there was a Japanese doctor who mentioned a method for doing liposuction on an anemia patient. He gave a presentation once that if you do surgery on one thigh at a time, once a month, it could be done safely. It was a conference I was chairing, and I asked him a question. I can't agree with the idea of doing the other side a month later. The chances of ending up with uneven legs are just way too high. I don't even know how high the chances are of ending up with uneven legs. Even if you do both sides in one day, but doing one side each month, I just can't agree with that. Most doctors are right-handed and operate with just one hand, so it's really tough to get both sides to match perfectly. So thigh liposuction is... Whoever does it is going to have lumpy bilateral scars that look ugly and be asymmetrical? Of course not. Here's a solution. If it's a doctor who's been doing thigh liposuction for over 10 years, then they're probably less likely to end up with lumpy and asymmetry. So if you're doing with experienced doctors, you really don't have to worry too much about the lumpiness. But bilateral scars aren't an easy to do. In our case, we shave a bit of the pubic area and make an incision in there. And another incision just above the anus. Depending on the situation, I might even cut inside the belly button. With this approach, I can reach all the way up to the upper calf, unless the person is very tall or has big knees. How is that possible? Well, I use a long 60-centimeter cannula. Does it sound really complicated? Yes. Think about it like this. Imagine using those long chopsticks you use for frying to eat your rice. If the chopsticks are long, it would be really tough to pick up your food, right? It's not impossible, but definitely difficult. Doing surgery with such a long cannula is also really challenging because thighs have a lot of curves and are quite long. But I don't really like visible scars, and I don't want you to worry about scars later on. That's why I choose these tough methods for surgery. With this approach, there are no traces left. Whether you're wearing regular panties or even a thong, you won't see anything. No one will know, even at the bathhouse. Isn't it important for aesthetic surgery to be done discreetly? Today, I talked about thigh liposuction. If you have any questions or concerns related to liposuction, feel free to leave them below. I'll be happy and do my best to answer them. If you need more detailed explanations, I'll make a video and upload it. So your likes and subscriptions. It really helps me a lot as I keep making these videos. Thank you.